Hello and welcome to the Spectrum Series Network Solutions presented by Nova Healthcare. Today we're going to talk to you about some different options for your network, for your clients, or for your employees. And we're going to get started, but first a few housekeeping items. Everyone is on mute at the moment. We're going to keep it that way for the entire presentation. We're going to hold questions until the end and then do a Q&A after we're done with the presentation. So if you have any questions as we move along, please put them in the box marked questions and we'll be able to address them that way. And just introducing today's panelists, we'll start with me. I'm your host, Teresa Vincent, the product manager at Nova. We are joined today by Will Slocum, the vice president of business development at 6 Degrees Health, and also Leah Lavicat, the data and reporting analyst for network solutions at Nova, and Jamie Farrell, our vice president of population health and product management. Thank you for joining us today. And Nova Healthcare has been around since 1982. We do provide your full TPA solutions, medical, dental, vision, COBRA, reimbursement, account administration, private label partnerships. But we also think that we're much more than a traditional TPA. We really seek to be an innovative health solutions company. That's partially why we're here today with one of our partners, 6 Degrees. 6 Degrees provides provider market analytics, reasonable value claim reports, claim negotiations, and reference-based pricing, which is what they're going to talk about with us today. So thank you for joining us, 6 Degrees. So the spectrum of health plan performance management opportunities, just to give this webinar a little bit of context, is a framework that Nova uses to really talk through all the different options that you have for your health plan to guarantee that you are getting the most out of the benefits that you're providing to your employees, or if you're a broker, that you're providing to your clients. So it's a really simple visual framework, as you can see from this picture, and we really break it down into 3 parts. So whether you're a broker or you're the employer, you really tend to see your health plan as maybe just one thing, that one white light source, the company profile, the employees that you serve, the market that you're in, the work that you do. But when you join with a TPA partner, that really functions as a prism. So that's how we want you to think of Nova, as a prism that reflects that single source as it comes in, and then gives you all of the rainbow of creative solutions for all of the needs that you have for your healthcare benefits. So over the course of the next year or so, we're going to go through individual webinars on each of the different wavelengths and the gradients within those colors, from network to telehealth to wellness, medical management, pharmacy management, benefit design tiers, and reimbursement. Today's session is going to focus exclusively on network solutions. And with network solutions, we really want to be your partner and your expert to help you and your members get right care at the right time in the right setting. I'm going to turn it over to Leah Lavicat, our expert, to walk us through all the different points on the network solutions spectrum.
Thanks, Teresa. It's important to note first and foremost that there's no right or wrong choice on the spectrum when it comes to the network solution. The decision process should be based on really the needs of you or your client's specific population and their comfort with change or making adjustments to their plan design. Depending on that comfort, Nova offers 3 options. The first option that we'll go through is a structured option. That's more of the traditional network solution with both in-network and out-of-network coverage for participants. It's composed of regional or recognized regional and or national networks. The second option is the hybrid solution. In this type of solution, a traditional network as well as a newer alternative arrangement is combined. One example of this type of solution could entail implementing a physician-only network and coupling that with a reference-based pricing solution for out-of-network or facility claims. And our third option would be considered an open choice solution, which would really depend on how much risk the client is willing to take. Essentially, you're not utilizing a network at all. Participants are really given the freedom to choose where they want to go for services. So network is merely just a piece of the puzzle, and finding the most appropriate network solution for your plan is only the first layer of cost savings. Later in this series, we'll present other services that Nova offers to help optimize that solution. And as a partner, the TPA should highlight these areas and help you navigate your choices and continually review that solution chosen to ensure that it's working properly for you. So really, where do we start? As part of an evaluation of what type of network arrangement you should implement for your plan participants, there are key things to consider. First is geography. Where are your plan members located? We can offer reporting to show, for example, if a structured solution was implemented, is there adequate coverage for members? Or is the region heavily dictated by a large hospital system with maybe a physician group, which may direct you more towards that hybrid approach? Are employees scattered throughout the country or located within one primary city? You know, urban, rural populations, competition between health systems, if there are multiple within the same area, those are all factors. The second thing to consider is your demographics. The demographics should absolutely be considered. What type of employer is it? Is it a younger population that are healthy, or do they move around a lot? A young, healthy population, for example, may not benefit from a reference-based pricing solution because they may not have those high dollar claims that are going to give you the cost savings that maybe an older or less healthy population would. Next, what are your plan goals? Is the plan to lower costs for you and your employee? Then maybe a reference-based pricing should be consideration. Or are you comfortable with implementing changes to the plan design? If you're currently fully insured, you may want to implement drastic changes and maintain some level of comfort. You may not want to maintain some level of comfort for your members. Last is the appetite for change. As just mentioned, are you coming from a fully insured model and prefer to take a less aggressive approach to maintain that traditional model until you're comfortable with the self-funded model? Moving right into an open choice plan from a traditional model can be overwhelming. So a lot of times clients will decide on that full replacement after maybe having some success using that hybrid model. You know that as a client, you'll experience member and or provider noise with any type of this model. So whatever solution you choose should be dictated by the goals of the employer, really. And I think Teresa is going to start us off on taking a more detailed look at each of those models.
Thank you, Leah. Yeah, so once we you have a chance to sit down with you and understand what your goals are, what your needs are, how does that actually look in the real world? And how do you know where you may fall on the spectrum or where you want to head for the future? This is not just a one-time discussion. This is a discussion that happens over and over again over the course of the life of your benefits plan. So we look at what you need in the short term, but we also plan out for the long term. So you may start out in the structured environment. You may be a client who's new to self-funding. Your employees may or may not be scattered throughout the U.S. They may or may not travel for work. That's really, up in the air with the structured. But these are really groups that want minimal disruption to their current network access. So whatever they have now, they want to keep that the same. They don't really want to shake things up too much. And in most cases, they're going to rely on that brand recognition or familiarity that would come from a leased network, whether it's a national network or a well-known regional network. There's a lot of comfort, as Leah said, to using those networks that people are more familiar with when it's all new to you, if you're new to self-funded. So I'm going to turn it back over to Leah to talk about the network insights of how she works with the clients to figure out what is a good fit.
Sure, an ongoing responsibility for us as the TPA is in evaluating, the effectiveness of the network solution we implemented and continuing to ensure that it's working for you. Access and utilization reporting is done at very least on an annual basis to ensure that members have the network access they need and that they're utilizing their benefits appropriately by choosing network providers when they are seeking care. Assuring a high percentage of network utilization is always important in a structured model. If there are any gaps or specific recruitment requests by the client or member, NOVA has maintained strong working relationships with our national and regional networks, and we can work directly with them to ensure that the access to care is there and their providers are participating. NOVA can also implement a process for claims that may fall outside of the primary network arrangement. That could look like the implementation of a national network to act as a wrap, or sometimes referred to as a travel network, for when members seek care outside of their primary network. Or another option would be to implement a reference-based pricing solution for those out-of-network claims.
So once we get the claims in, or once we have members interacting within the system, there are going to be questions, and that's where care navigation comes in. So I'm going to turn it over to Jamie, who's going to walk through some of the care navigation support options we have in the structured point of the model.
Thank you, Teresa. So care navigation support is integral in the success of any of these network configurations. And in this structured model, Members receive concierge level service to help maximize the in-network utilization and minimize disruption to members either new to the plan or for clients who are offering the new network for the first time. All member inquiries are handled by a designated team of care navigators who are trained specifically on the client's network configuration. This team assists the members in identifying in-network providers and answering questions related to in and out of network processes and services, as well as to help with submissions for in-network recruitment. Care navigators are trained to discuss the why behind questions about out-of-network benefits for services and really use it as an opportunity to educate members on providers in their network. Care navigators can also perform welcome calls to new members and perform ongoing outreach to those on the plan with out-of-network utilization to address topics such as assistance with provider search, appointment scheduling, or providing education to plan participants on the technology available to them through their plan. In addition, we also see an opportunity for the prior authorization process to inform strategies for care navigation support in network provider utilization, and really to also help identify the need for centers of excellence utilization, as an example, transplants, or also to help get ahead of any direct negotiations that may be needed for a certain provider who does not participate in the network, or if the network does not have that specialty. So with that, I'll turn it back over to Teresa to introduce us to the next point on the spectrum.
Okay, so moving on from our starting point, now we shift over into the hybrid model. And as we go through the spectrum, you may think like, I don't really fit in one place or the other. I'm kind of interested in structured, maybe I'm more interested in hybrid, and that's fine. The thing about the gradients of the spectrum is that there's a lot of room to move within. It's usually not like I'm one thing and that's all I am. We're showing you how you move through, you know, or if you stay where you are, that's fine too. Like Leah said, there's no right or wrong way to build your network. It's just what fits for you. So you may be interested in a hybrid model if your client has employees in one area. If you're maybe looking for an alternative to that national network, you don't want to lease a network, you want to do something that's just a little bit different in structure. And we've also had a few with health systems. As we know, the healthcare sector is a very big employer. And sometimes they may have an arrangement that they want to do where they want their own employees to go to their own facilities or their own doctors for services. So these are the sorts of things we can structure as a hybrid network. It may also be called a tailored network. You may be familiar with that terminology. So this is one of Will's areas of expertise. So I'm going to turn it over to him for some insights into how the hybrid network spectrum works.
All right, thank you, Teresa. So at 6 degrees, I think most people may be familiar with 6 degrees. We certainly do reference-based pricing, and the way we bring that to the market certainly is the hybrid model is one of the main ways I think people are very familiar with it. 10 years or so ago, 12 I guess, when we first started selling reference-based pricing, it was pretty common that people would buy a physician network, and then they would just do no network for facilities. And so typically that's fairly well known. A lot of our groups have gone to full network replacements, which we'll talk about in a second. But in addition to that, in the last year, we've seen some of the national carriers that are also selling their PPO options alongside a reference-based pricing option. So you could have a group that has, you know, option 1, which is a normal PPO, and then option 2 that is all reference-based pricing. So the hybrid can take multiple different forms. And as Teresa said, a lot of our clients are hospital systems or physician practices or other medical services, and they want us to simply manage claims that fall outside of their own facility. So we would manage in most of those scenarios a non-domestic claims. So if you have a hospital that's a current client, you know, don't think that they're not a good fit for reference-based pricing. Frankly, they're quite a very good fit. And a lot of it has to do with the fact that they understand how billing and all the rest of that stuff works. The other thing that we've seen in the last year or so is really the rise of these direct primary care networks. Personally, from my perspective, I think that's one of the best things that has come along to the benefit industry, or benefit solutions, in quite a while. And part of the reason for that is that when you have a group of physicians where your employees are incentivized to go, and generally the way they work, you're going to pay some sort of a per employee per month fee, and then members can go to that direct primary care physician, and there's usually no copay. There's certainly no payment from the member, but because the plan is already paid for that in their per employee per month fee. Well, the result of that is that we have a group of physicians that we can easily communicate with, and we may want to communicate things to them like, this particular hospital is really the best place for your member to go. We would prefer that you not direct them to that hospital, that sort of thing. And we found that to be very effective. So if you have thought of doing facility only reference-based pricing, but we're a little confused as to what to do with the physician side, the direct primary care is certainly an option you should take a look at. In whatever marketplace you happen to be in, there may be some really good options for direct primary care. The other thing I think is that as you're dealing with a direct primary care, you certainly have to be able to analyze how the claims are going that are not directed into that DPC. So it's important to have a plan for anything that you might think of as out of network. So on the 6 Degree side, it's pretty normal for us to sell facility replacement of the network, maybe combined with a DPC, and then we would handle any claims that fall out of that network. So we would have an opportunity to report back to the client as to kind of what's the utilization of that DPC. Maybe it's not going all that well, and certainly you would want to evaluate the dollars to see if that was worth the effort from the employer's perspective. But that gives you kind of a big overview of the hybrid model. Teresa and Jamie, I'll pass it to you.
Jamie, how would we support that from a care navigation model? That seems like it's pretty different from the first one we talked through.
Yeah, Teresa, thanks. So just as I mentioned previously, care navigation support is essential to the success of this hybrid model. And care navigators are trained on the specific network configuration, such as the physicians only network that was referenced, a reference-based pricing wraparound, or the direct primary care offering and the services that may or may not be included within it. If we take that example of the direct primary care, it is absolutely critical to coordinate between the entities to ensure that the solution is maximized and that opportunities are not missed and services are not duplicated. So the proper care navigation services can help identify opportunities to bridge the typical gaps that may exist between providers and payers or TPAs. So we have experience with integrated care navigation processes showing positive cost savings results for our clients with some standardized processes that I'd like to share. So I have two that I would like to share with you. One is with respect to the direct primary care benefit promotion and overall roster management. In a DPC arrangement, it would be a best practice to receive a plan participant roster of all members who have established as patients of the direct primary care. And this information can be housed in one member profile and really referenced by our care navigators in each interaction or inbound call from the member who are offered that solution. And when calls are received from a member who hasn't established with a DPC provider, care navigators provide education on the benefit, and they also help to facilitate onboarding and appointment scheduling with the DPC. Another example that I'd like to share is with respect to utilization management, integration, and coordination with the DPC. So rather than simply reviewing requests for medical necessity, as we would in some of the other more traditional models, a process can be performed where we share the request with the DPC provider, as long as that member is established with the DPC, to ensure that they're aware that the patient is seeking that care or those services. And this allows the DPC physician, when applicable, to perform outreach to the patients, advising them of lower cost, less less invasive treatment options, which in turn produce better outcomes and savings to the self-funded plan. So by working in collaboration with the provider and the patients, we're able to save employers money, improve employee satisfaction with the plan, and help the plan participants engage in their own health and follow a plan of care for improved health outcomes. So I'll send it back to you, Teresa, to launch into the open choice portion of the spectrum.
Great, thank you. So as we've been moving through the spectrum, we started with the more established model that people really recognize, but now we've moved over into open choice, the further end of the spectrum, which is more of an emerging area. This is a space in networks where we're seeing things that are still evolving as we're moving forward. So keep that in mind as we talk through. There are some very good options here, but expect this to be an area where we see more coming in the future. This may be a great choice for a company that is currently self-funded. As Leah said earlier, you probably don't want the disruption of going from a fully insured group right into open choice, which functionally means no real network at all. And your employees may or may not be scattered throughout the US or travel for work. That's really variable. And they would still have limited or zero disruption for their current network because they would essentially dissolve the walls that go around a network, and they wouldn't have a network to choose from. They could go to any doctor that they wanted, any facility that they wanted. So this is really for companies and brokers that are looking for alternatives to that national network solution, to a regional network solution, or to any sort of solution that puts people that you can only go to these people in network, these people are out of network. It eliminates those buckets completely. So it relies heavily on reference-based pricing, which I'm going to turn it over to Will to talk through how this looks when it's actually functioning in the marketplace.
All right, thank you, Teresa. So I get this question pretty frequently from brokers, really kind of all over the country. It is, why do clients or groups head toward reference-based pricing and then turn around and head back to a PPO? And so the first thing I want to talk about is just sort of the fit with the client. The most common reason that happens is not because they didn't save money, because if you go down the road of reference-based pricing, you will save money. We'll talk more about that in a minute. But if we set an improper expectation with the client, they're going to be very unhappy, and you as a broker will be unhappy, will be unhappy, the TPA will be unhappy, and it's just a kind of a mess. So I think a big part of what we have to do at the beginning is to make sure that the client really is a good fit for reference-based pricing. And I guess the way I would say it is this: we know exactly what's going to occur with a reference-based pricing group. And so I think it's incumbent upon us to communicate that clearly to the client so that they can make their own decisions. So if you do a full network replacement, which is what we're talking about here, just think of it in two basic components. You've got a facility, which would include the inpatient, outpatient services, and then you've got professional, which would be like office visits, doctor office visits, and things like that. And so we handle both of those two groups of providers differently. On the facility side, you don't usually see access issues. That's where you would probably see a little bit more of the balance bill type scenario. And on the physician side, where we don't see a lot of balance bills, we do see a lot of access issues. And so one of the things that we do at 6 Degrees that I think is a pretty big benefit, and I think some of the other vendors may do this, they may not, you can certainly ask them, but one of the things that we've done for a while now is if we have a group that comes on to 6 Degrees and we are going to be handling the physician side of their benefit program, we are going to do outbound calls to the physicians that group has seen usually the previous year. And the idea is that since it's not really a problem with our payment, most of the times what we're dealing with as far as access issues on the physician side really have more to do with the fact that they're a little confused on how to bill so that they get the payment they want back. And so we will get a list of all the physicians, and then we will begin those outbound calls as we kind of prioritize those. So the proactive outreach, I think, has been a pretty big deal for 6 Degrees. Another thing I would point out is that when you in our book of business in 2020, our average balance bill rate was 1.2%. So said differently, that means that 98.8% of the time, the providers were accepting our payment, and our payment usually would be 140% of Medicare. Well, so with that kind of a statistic, the one thing I would point out is if you're a broker and you're going to sell reference-based pricing to your client, you can't allow them to think that they're going from a network solution that has zero noise to a reference-based pricing solution that has all this noise. Because the truth of the matter is, I would be willing to bet that our balance bill rate is actually lower than what networks would see. And certainly it would be true if you ask employees, just to comment on bills they don't understand. So the point here is that we're providing a pretty solid service, even without reference-based pricing, just to be somebody that the member can send bills to and we can evaluate. The other point I would make is that when we look at our book of business, we know that literally the number is 90% of all of our balanced bills are below $10,000. And another interesting statistic is that 40% of those balance bills are below 500 bucks. So some of our groups would tell us that when we do get a balance bill and maybe we were unable to resolve it for a whole host of different reasons, and the client basically then directs 6 Degrees that if the claim is under a certain dollar amount for us just to allow or authorize payment. And by doing that, if you set your threshold, let's say at $500, you could essentially get rid of 40% of your balance bills. So I think that balance bills are always something that we have to deal with when we're talking to clients, but I think there are some really good solutions. And the last thing that I would point out is you can't talk about balance bills without a complete understanding of what the savings opportunity is. And one of the things I would say there is that in most groups, it would be a solid number for you to tell a particular client that they should save, year over year on a claim spend somewhere in the neighborhood of $200,000 per 100 employees. Another way to look at it would be in most of our groups, we're going to see somewhere between a 30 and 40% claim reduction. And so when you look at that overall spend, all of your fixed costs and your premiums and different things like that, that number is going to be roughly in that range of 25 to 30% of total spend. So the point I guess I'm making here is that those numbers become so large that an employer is absolutely willing to handle some member noise because the dollar volume is so big. And I guess the last thing I would point out is a successful group in reference-based pricing is going to be one where once we do realize some of those savings, or that employer does, that they're willing to push some of those dollars back into their plan to make the plan better. And that would be in the form of either lower payroll deductions or certainly lower deductibles and things like that. So those are just a few good points about how you could structure this, and certainly either contact Nova or 6 Degrees, and we're happy to talk you through that more specific on any specific group. Jamie, I think I'm kicking it to you.
Thanks, Will. So, care navigation in Open Choice provides multiple layers of support for members in this type of plan. First and foremost, on the overall plan design education and how it differs from what they may have experienced previously with a structured or a hybrid network plan. Secondly, care navigators have resources available that can indicate specific providers' historical acceptance of the reference-based pricing methodology and provide those as options to members who call in for assistance in locating a physician or a facility. Members are always educated to call our care navigators if they receive any type of bill, and the care navigators help them determine if it is in fact a balance bill, as sometimes it can just be a bill for the member's responsibility under the plan. If it is a balance bill, our care navigators partner with a reference-based pricing solution, such as 6 Degrees, and warm transfer the member for additional assistance and further discussions and ultimate negotiation with the provider if needed. So with that, I'd like to turn it back to you, Will, to walk through a client case study with this open choice model.
Thank you, Jamie. So I think that most everybody would assume on the call, at the end of the day, what you really want to know is, okay, how does this actually work for a real live group? And so Nova and 6 Degrees, we have a number of clients together. And so we were looking through the different options as far as what to present as far as kind of a success story. And the one that I chose was a company that's been with 6 Degrees since 2018. Prior to coming to 6 Degrees, they were, of course, self-funded. They're 979 employees, as you can see there. When they came to 6 Degrees, they were doing a traditional national network. So I won't name any of those names, but there's only a few of them out there, so you probably can guess at who that would be. And what we saw was that their billed charges for, again, inpatient, outpatient, and professional were $20 million. The network allowed amount was $10 million. And so looking back at that, we now want to look a little forward. Well, how did that happen, or what happened in 2019? And we'll, of course, look at 2020. So in 2019, what we saw was, almost exactly the same billed amount, and that would be fairly normal given the size of the group. Their claims are fairly credible, and so not a lot of change in their billed numbers. So that, again, that's another thing, but that's just more of a self-funding conversation, I think. But what we were able to accomplish within this particular group, roughly the same amount of billed charges in their first year. The allowed amount for their inpatient, outpatient, and professional was $5.8 million. I'm sure everybody on the phone can do the math, but you can see that's roughly, getting fairly close to a 50% reduction, 40 something within that first year. And then again in 2020, we saw a billed amount that was roughly the same, and the allowed amount was 6.7. Again, those numbers are fairly close. And so when you compare all of this and add it all up over their life over that 2-year period, we'll get to that in a second. The next thing I think that everybody would be interested in knowing is, well, how did the claims work out? What was kind of the member disruption, the noise, the access issues, the balance bills, things like that? Well, in 2020, 6 Degrees processed, and by process that means that we audited the claim, we determined what Medicare would have been, then we tell Nova what the allowed amount is, and so we did that on 18,403 claims in 2020, and the total number of balance bills was 244. As you can see, the balance bill percentage was 1.33%, which is right within our national average. At the time that I pulled this data, there were 52 balance bills that were still open, and then there was 192 that had been closed. Those 192 that were closed, the total amount that we paid to settle those claims was $282,000, and that, by the way, is added back into the overall claim allowed number. So certainly you can see that there's still pretty good amount of savings. There's also was access issues, and an access issue is going to occur. Again, largely you're going to see those at physician practices. They're fairly simple to resolve. The TPA, Nova, we've worked with them to make sure they know what they need to do on the front end. We're going to tell members to call the TPA first, and in most cases, the TPA can resolve access issues. Sometimes they can't. And in those scenarios, they would send those to 6 degrees. But we know that of the 90 access issues that we had in 2020, they were all closed at the time I pulled this report. So over this 2-year period of time, you can see that the overall claim reduction here was about 37 or almost 38%. And I don't think there's anybody out there that would disagree that that was financially worth it for this group. And like I mentioned before, what this group, of course, has done is they've pulled some of those dollars back into the plan, and so the members' deductibles have certainly gone down versus going up, which everybody's very familiar with. So it's a solid solution to making a plan better. So there you go. Hopefully that was helpful.
So we walked through the entirety of the spectrum of network solutions as we work through them every day. And you know what the formula really is at NOVA to achieve those health plan performance opportunities. We understand your tolerance for change by sitting down, talking with you, the process that Leo walked through about how we understand your demographics and your location and all of those different factors. We really engage in these conversations in an ongoing way. It's not just we sit down at the beginning of your plan year and that's it. We have a shared goal of improving plan performance and health outcomes. So we are a TPA, but you know, in our case, I think what that really means is true partnership administration. We are collaborative and work together with you and with our experts like 6 Degrees to ensure that we are providing the full formula of understanding where you are, engaging in conversations, and achieving those plan performance and health outcome improvements. So that is our content on network solutions for today. And next up on April 14th, we are going to be doing a similar format in our Spectrum series, but this time focused entirely on telehealth solutions. So if you've signed up for our emails already, if you watch your inbox, you'll see registration information coming out shortly. And if you follow NOVA on LinkedIn, then you'll see updates of whenever these events are coming up, and they'll be going on for the next year. I'm now going to open it up for questions. We did get a few that came in, so I'm going to start with those. But if you have any other questions, just remember to put those questions in the question box. And the first question, it looks like it's for both NOVA and 6 Degrees. In your experience, what's the average group size of clients who use reference-based pricing?
Do you want me to go?
Sure.
I mean, it's a good question. I think that the simple answer is that the group size doesn't really matter because, you know, whether it's a 1,000 life group or 150 life group, they're still going to have claims and hospitals are still going to overbill. And so the only difference would really just be the volume of claims, but the dollar savings would be the same. I would say that the bigger question, which I think Teresa may have mentioned earlier, is, you know, is the group currently self-funded today? If they are, that is just an easier sale. You know, not that we don't have groups that go from fully insured to self-funding and to reference-based pricing, but that is a little bit more of a heavy lift, I would say. So size is probably not as important as much as kind of the specifics of that particular group. That would be what I would say.
I would say we would agree with that as well. I think we have some variability in the group sizes that are currently using reference-based pricing, and I think that that we'll hit the nail on the head with that one. So we'll move on to the next question, which Will, I think you may have answered this in the presentation. What is the average % of Medicare that 6 Degrees pays?
I don't think I said that, but our average in 2020, we allowed, and again, this includes our initial payment plus any negotiated additional payments. Our Medicare average is 152%. So we're averaging 152% of Medicare across our book.
Okay, and then the last question that's come in, unless any pop up in the next minute or so, what should an employer expect for reporting for a reference-based pricing plan?
Do y'all want to hit that from NOVA, or do you want me to hit that from 6 Degrees?
We can start on the NOVA side.
Yeah, I can address that, Will, and then if you'd like to add some of the specifics with respect to reference-based pricing, please feel free. So what we would typically provide, as Leah said, we do, ongoing analysis of the effectiveness of the solution, whether it's structured, hybrid, or the open choice. And we do provide reporting routinely to our customers with respect to the percentage of, if it is the structured or hybrid, the percentage of in-network utilization, whether that be from a cost perspective and also from a utilization in terms of volume of claims. And then we take a look at what was paid and allowed on those as well. And we also have the ability to kind of drill in to some of the different provider demographics and the top providers utilized by a particular employer or population. And then, in the instance of reference-based pricing, we would bring in the additional metrics, much like you saw in the case study that Will reviewed, with respect to just the overall spend, balance bill rates, access, issues, open and closed, and all of those. Will, do you have anything you'd like to add to that?
Jamie, you kind of covered it. On the 6 degree side, we do quite a bit of reporting for our groups. All of our employers would receive a monthly report, which, kind of like you said, it's going to detail every single claim that we touch, as well as any kind of what we call appeal or case reports, which would be access or balance bills or different things like that, where they may be in the process of, we just got it in all the way to already settled. So we would tell that, show that to an employer, and that's going to include what was originally billed, what our allowed amount was, as well as what the balance bill may be, or if there was an additional payment, what that is. So all of our clients are getting those reports monthly, and in addition to whatever the reports that you as a TPA would provide.
Yeah, that was all the questions that we had for today. So I think we're ready to wrap up. Thank you for joining us today. We look forward to seeing you again in April when we do this again to discuss telehealth. If you come up with any other questions or would like to sit down and discuss further with anyone from NOVA, just reach out and we're here. We'd be happy to connect you to 6 Degrees as well. Thank you and enjoy the rest of your day.
Bye, guys.
Thank you.
Thanks.